September is Suicide Awareness Month, and with mental health challenges on the rise, area schools are providing resources to help their students and staff. News 19's Crystal Flintrop was at Winona State University and explains how one small addition will make the biggest difference.
According to the National Education Association, more than 60% of college students meet the criteria for at least one mental health problem. More specifically, 44% reported symptoms of depression and 15% say they considered suicide. With students and staff back on campus, Winona State University has made one small change to provide much-needed mental health resources to those in a crisis.
You're never alone. There's always someone that you can talk to. There's always someone that's willing to support you.
A message Winona State University wants its students and faculty to remember with the start of the academic year. And for those facing mental health challenges, there are a variety of resources to utilize on campus.
Our job is to help remove any barrier that might prevent a student from being successful. We have our counseling services that is, free and confidential and open to all students. We also have a lot of support services with academics and, tutoring.
Ever since the introduction of the 988 Suicide and Crisis Lifeline, WSU has been working to make that number accessible to all warriors. An addition that came to fruition this year.
We decided that putting it on ID cards was probably a really good way, since every student and employee has ID cards that they use, some on a daily basis, to access various things on campus. So it would literally be in the palm of everyone's hand. And then we also decided to include the local crisis number as well, just because sometimes they can actually be dispatched to a student.
Winona State's hope with putting the 24/7 Crisis Lifeline on all IDs is that at least one person's life will be saved, and to break the stigma around asking for help.
It may be hard, it may be uncomfortable, there's a lot of uncertainty, and a lot of times to be comfortable, we don't ask for help. But it's okay, and it feels good. One thing that I often tell people when they're thinking about asking out for help is that you're worth it. No matter what you're going through as a human being, you are worth it. And I know sometimes it's hard to ask for help, but it takes great strength and courage to do it.
It's not just students and staff that can utilize those crisis lifelines. Anyone in the community facing mental health challenges can. One of the hopes with this initiative is that more people will learn about these resources.